Hi, this is Bree Slade, and we are in the doghouse together again, talking about your sick pooch. Nothing worse than having a sick dog or thinking your dog is sick and not knowing what you can do at home. So we're going to talk about being ready for that emergency. Have your emergency vet number saved in your cell phone. Know where it is. Know what time it opens. Your regular vet, know their hours. Even get your veterinarian cell phone number if you can. I would put that right in my pocket. Think airway, breathing, circulation, A, B, C. That's how you know if it's an emergency. A for airway, B for breathing, C for circulation. Airway and breathing. Any difficulty breathing, go to the vet. Any swelling up in their face or neck, go to the vet. That could be an anaphylactic reaction or a snake bite in the face or the neck area. Sometimes dogs stick their faces in areas they're not supposed to. That's all reasons to go to the vet. C is circulation. Bleeding. If they're squirting blood, you have to go to the vet. If they're dripping it on the floor and making a puddle, or you can't hold pressure and get it to stop, that's a reason to go to the vet. But what are some things you can do at home? Check your dog's temperature. I don't think they look right. I'm going to check their temperature. Have a thermometer that's labeled dog, rectal, so that you don't use it on any humans. You just press the button to turn it on. Petroleum jelly can be obtained from the dollar store. Just right in the end of that, keep all this in your doggy cabinet. You insert it 1 inch into your dog's rear end and monitor their temperature. It'll beep when it's done. 101 degrees Fahrenheit to 102.5 degrees Fahrenheit are all normal temperatures for your dog. 101 up to 102.5 degrees Fahrenheit. So 103 is a fever. 99 is too low. Reasons to go to your vet. Do check it twice. Just insert straight, nice and gentle into the rectum. Second thing you can do is look at that nose. A wet, drippy nose, that doesn't mean they're sick, but a dry nose doesn't mean they're sick either. Maybe they just need a little bit of water. So the nose is one of those tricky things, but you can check their gums. Lift those lips up and look at those gums. Pink gums are great, bright pink, almost red, but not quite red. When you push your finger on it and let go, it should turn white in that spot and then quickly, 1 to 2 seconds, turn pink again. That means your dog's not dehydrated. White gums, yellow gums, get to the vet. That's an emergency situation. You really want to get there. Cough is not necessarily an emergency. Call your vet. Coughs usually resolve within 3 to 5 days. Dogs get colds all the time. Not usually needed to go to the vet for that, but do call your vet and make them aware. They may want you to just come pick up medications because coughs can be so contagious. I want to talk to you about some big deal things. We touched on toxicity yesterday of plants. Watch your house, your pool, and your yard. Anywhere your dog goes, make sure plants aren't toxic. Post a picture of your plant on my wall and I'll let you know if it's toxic for dogs or not. Also, chemicals, medications, and other foods. Your dogs can ingest things that are toxic to them and you want to make sure that you know what they've eaten or gotten a hold of so that you can get to the vet because those are emergency situations, toxicity. Bufo frogs, big, wide, flat frogs. Bufo frogs are very toxic in dogs. Just one lick could even kill a dog. Don't feed your dogs outside. Bufo frogs are attracted to dog bowls outside, and we don't want that. We don't want them around our house at all. One lick could take your dog down. Signs would be vomiting, diarrhea, foaming at the mouth, scratching at their face, bright red gums, hose their mouth out and down towards the ground to get the toxicity out of their mouth. Don't hose down the back of their throat. Don't push more in. Hose it out. Call your vet right away. Seizures. So BMC Veterinary Research is doing a lot of work on seizures in dogs. Not all seizures is long-term treatment and long-term medications. Lots will be idiopathic. Some are because of other more pressing reasons that we really need to go to the vet, like low sugar or heat stroke. So sometimes seizures might be something else that's even more serious than the seizure. Don't ever put your hand in a dog's mouth or look in their mouth if they're having a seizure. They will not swallow their tongue. Other things to watch out for is bloat. If you have a large dog with a large chest cavity, like a Great Dane, a standard poodle, a pit bull, a German Shepherd, a big dog, any of your large breeds dogs, they can bloat where one or both sides of their stomach torsions and falls over. It is absolutely a medical emergency. They look painful and fearful. They cannot vomit. They cannot have diarrhea or poop. They often will not lay down. They will drool and they need to go straight to the vet. They'll be super tender in here. Limping is not necessarily a need to go to the vet. Non-weight bearing on 1 foot, the 3-legged dog, that usually means that something's broken there. But a slight limp you might want to watch for a few days. If it doesn't resolve on its own, then you can definitely take it to the vet. Prevent, 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 prevent. Go to your vet. Make sure that you get heartworm prevention. Make sure you monitor for fleas and ticks. Do your vaccinations. Once a year they should have a fecal examination. So those things, once a year trip to your vet is so good for prevention. Tomorrow our talk is going to be about table scraps. What's good, what's bad, the good, the bad, and the ugly of table scraps. This is Bree Slade. I'm in the doghouse with you. Don't forget to like and share. Thank you so much for your time today.